This is purple aster. We use the roots. Roots are these kind of crazy looking, like reddish things, but they're used for coughing and wheezing, so that's a commonly added to like an asthma formula. If you look at asthma rates in this country, it's primarily urban areas in poor communities of color. And I know specifically for City Heights, asthma is an epidemic, particularly amongst young people, like it is in most urban areas. And a major problem that we have here in City Heights is really poor housing conditions. You have tons of really bad old apartments. You have landlords that just aren't fixing up apartments. You have old carpets, mold, cockroaches, rats. Those are all like major irritants, triggers for asthma.
We started with a focus on health problems that have environmental roots that are super common in City Heights. And so we started off looking at asthma, diabetes, and conditions that are kind of caused by long-term stress and tension. There tends to be a lot of take these pills, change your lifestyle, no real guidance. The pills have a lot of side effects and often aren't very effective at managing the conditions. There's no differentiation between what people are experiencing. It kind of becomes just an overall, you have diabetes, deal with it.
And plus it's a major class issue because, I mean, if you look at what's cheapest, I mean, crappy food, unhealthy food is the cheapest. You're able to buy more calories for your dollar if you're buying unhealthy, nutrient poor, but high calorie foods. There's a real blurry line between food and medicine because food is medicine. And if you look at lots of these plants here, I mean, there is no clear distinction between herb and food. And diet is something that's so crucial to all these problems that we were talking about.
Herbalism was really one of those ways in for me to figure out just how to relate to my body with all the complicated problems I was experiencing.
When we're talking about any health problems, we can't just talk about herbs, we can't just talk about food. We have to talk about every aspect of a person's health, and that includes emotional, physical, spiritual.
We work with other groups in the community to talk about means of self-care, means of reducing your need for medicine, of understanding what's happening in your body so that way you're not quite as powerless in the dynamics of the Western medical system.
It's really important, I think, when you're talking about a problem like asthma, and not to just like treat an individual and say, okay, how are we gonna deal with your asthma? You know, look at nutrition, look at herbs and stuff, but it's like, we have a major epidemic here, so what are we gonna do as a community to kind of resolve this problem? Because it's not an individual problem, it's a community problem.